Ryan Reynolds here from Mint Mobile with a message for everyone paying big wireless way too much. Please, for the love of everything good in this world, stop. With Mint, you can get premium wireless for just $15 a month. Of course, if you enjoy overpaying, no judgments, but that's weird. Okay, one judgment. Anyway, give it a try at mintmobile.com/switch.
Upfront payment of $45 for 3-month plan, equivalent to $15 per month required. Intro rate first 3 months only, then full price plan options available. Taxes and fees extra. See full terms at mintmobile.com.
Ah, Smart Water. Pure, crisp taste.
That's really good water.
It's the kind of water that says, I have my life together.
I do feel more sophisticated.
Smart Water. For those with a taste for taste. Grab yours today.
Dr. Peter Michalos is with us. He kept his promise. We talked during the week when the news came out about Joe Biden's prostate cancer. He said he would join us this week. And so, Dr. Michalos, thank you so much for being with us. My first question, and I don't want to get into the whole politics of Biden and who knew when and all of that. I want to just ask you a question. Advanced prostate cancer. When should men how do men avoid having that same diagnosis in their lives?
Well, most people, as part of their annual physical, and in the United States, most people at 50, they start doing PSA tests. But since younger men are getting it, many internists and many primary care will get a baseline, usually at age 40, just to see where you are, and then you follow it. And when the prostate-specific antigen, which is basically a tumor marker, starts to rise and go higher and higher, then the doctor will do a digital rectal exam, which basically you feel the prostate because it's right in that area, and you can actually feel it. And if you feel a nodule, then that's suspicious, or your prostate is enlarging. When your prostate enlarges, it pushes on your bladder, so you think that you have to go to the bathroom all the time, so you find yourself early on getting up in the middle of the night, peeing more, and it puts more and more pressure. Then you have trouble starting and stopping urination. But if your PSA is climbing, the next step is you get a 3D MRI, and we never heard anything about anyone getting a 3D MRI in the news, and we heard that the last prostate test was in 2014. So that's why there's all this suspicion of when it actually started, because it takes years to start. Then if it is positive and you see it on the 3D MRI and the prostate is like orange and the capsule that it sits in is the orange peel. The problem is once it breaks out of the orange peel, that's when it's higher risk for spreading, and it usually goes to regional lymph nodes and to bone. The problem when it gets to the bone is it can become more painful. So the trick is to really treat it early. The good news is that the people, when they get it when they're older, they tend to have a better prognosis. And the options for treatment are you can either radiate it, which is basically like frying the tumor cells. The problem with that is that you can have collateral thermal damage where it can affect other tissues around it if it's not delivered precisely. That's why they have newer methods of delivering radiation, like proton beam radiation. There's also other treatments are basically prostate cancers grow with hormone therapy like testosterone. So if someone has a high PSA or at risk for prostate cancer or have several male relatives in their family with prostate cancer, it's probably not a good idea to be playing with testosterone therapy if you are suspected of having an early prostate cancer. Because
let me just interrupt you right there, because you see ads, I see ads all the time, especially for guys that are gym rats. And they want to up their testosterone. They're not consulting doctors. They're not even consulting getting their own blood work in some cases before they start buying pills that, here's testosterone supplements. There's a danger in that if you don't know what you're doing. Can you speak to that for a moment?
Yeah, one of the biggest issue is is clotting. And what happens is when you take testosterone, you're supposed to follow your hemoglobin, your hematocrit, which is how thick your blood is. And the more thick your blood is, the higher at risk for clots. Like a lot of these places aren't testing for something called factor V Leiden, which is a predisposition for clots. Clots in your legs, clots in your in all your that can spread to your lungs. So when you have high testosterone in your body, you get thicker blood. It builds muscle and blood, but your blood can get thick. So that's a thing that they need to test more. So you really need to be under the care of a physician to monitor your blood test, to monitor the levels closely. The problem is people are doing it. They're overdoing it. The other thing is, there are behavioral changes with some men who are trying to achieve very high testosterone levels. You become you can become hypersexual, hyperaggressive. Like you see some of these men, when you look at them, you can see they're doing steroids or anabolic steroids or testosterone. So it just has to be monitored. Just like if you have low thyroid, you take thyroid replacement. If you have very low testosterone, I think it's great that men can make their levels normal. The problem is people are trying to achieve very high levels and they're not being monitored appropriately. They're doing a lot of this stuff online instead of, seeing someone. But you can do it, you can do it virtually, but the doctor has to be checking your labs like every 3-4 months so you know where your levels are exactly and what's going on. So that's
okay. So prostate cancer, though, it may not be, and there's no cure. It may not cure. You can surgically remove it. You can defeat a cancer with the prostate cancer with radiation. I know this very, very well. And also, there's only one way in for the the prostate exam. A little bit uncomfortable, but it's worth it. Now, black men have a higher risk of contracting PSA. I would suggest, and I'm not a doctor, and just tell me if I'm wrong, but I tell my friends, look, even sometimes before you're 30, if you happen to be a black guy, go get your product. Just get the PSA test as part of your blood test. It's not going to hurt you. Just get it. Does that make sense?
Yeah, tremendous sense. I think it's very important. I think there need to be more public service announcements about the importance of getting PSA tests. Just like for women, we need to push women to get, mammography and to get checked out. And
right.
Also colonoscopy, all these preventable things that can, help people to live longer. Because it's not really, prostate cancer is not a death sentence if it's caught early and it's controlled. And even for advanced cancer, the hormone blocking that blocks testosterone, those people live longer. And there's even an exciting new medicine called Pluvicto that's radioactively labeled chemotherapy that knows and finds the surface of prostate cancer cells anywhere in the body. Not a cure, but it's shown now that it can slow down prostate cancer dramatically. So those people who've been diagnosed with prostate cancer and worry about recurrence in the future, there are options now that exist. So that's why early treatment is very important, and there are amazing new medicines coming out. There's even people working on prostate vaccines where they'll make custom made. When they biopsy your tumor, they'll take surface proteins off of your specific tumor and make a vaccine and make your immune system direct its energies towards that specific type of cell. So this is all coming up and exciting. So it's important to, early diagnosis is very important. And
all right, let me just ask you another question that's tangential to this discussion.
Your snacking routine can get a little dull. Time for a Light and Fit remix. Like a crunchy storm of graham cookies, caramel pearls, and dark chocolate, showering down into a smooth, creamy yogurt. Enjoy 3 Light and Fit remix varieties with craveable flavors and up to 120 calories and 10 grams of protein per 4.5-ounce serving. See remixyogurt.com.
Custom window treatments are a small upgrade that have a big impact.
No better time to shop than now at Blinds.com's Memorial Day Mega Sale. Blinds.com invented a better way to shop for window treatments, completely online with upfront pricing, no showroom markups, no salespeople in your home. Choose from classic shutters to outdoor shades and more, all backed by our 100% satisfaction guarantee. Shop Blinds.com's Memorial Day Mega Sale now. Save up to 50% site-wide, plus a free measure. Rules and restrictions may apply.
This episode is brought to you by Progressive Insurance. Do you ever find yourself playing the budgeting game? Well, with the Name Your Price tool from Progressive, you can find options that fit your budget and potentially lower your bills. Try it at Progressive.com. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law. Not available in all states.
Mic check. 1, 2. Are we recording? Hi, I'm Michelle Bernstein, an award-winning chef, restaurateur, and mom. I have a lot on my plate, including my psoriatic arthritis symptoms. That's why I was prescribed Cosentyx. It helps me move better.
Cosentyx secukinumab is prescribed for people 2 years of age and older with active psoriatic arthritis. Don't use if you're allergic to Cosentyx. Before starting, get checked for tuberculosis. An increased risk of infections and lowered ability to fight them may occur, like tuberculosis or other serious bacterial, fungal, or viral infections. Some were fatal. Tell your doctor if you have an infection or symptoms like fevers, sweats, chills, muscle aches, or cough, had a vaccine or plan to, or if inflammatory bowel disease symptoms develop or worsen. Serious allergic reactions and severe eczema-like skin reactions may occur. Learn more at 1-844-COSENTYX or Cosentyx.com.
Ask your rheumatologist about Cosentyx.
I had prostate cancer. I've talked about it. One of the things that I had the treatment that goes with it. It is a drug that makes your body think it's producing testosterone when in fact it's producing estrogen. And what it does is that helps deal with the cancer situation. That drug turns out to be the same drug that they are using for quote unquote gender affirming processes. And let me tell you, that is some powerful stuff. And what it does to your moods, what it does to your emotional state, it is powerful. And from what I understand, that drug was developed to fight cancer, was never developed for the purpose that it's being used for now. Do you have any insight into that?
Well, I think it's just being used off-label, and basically they're trying to block testosterone and to try to create feminization, which is what it does. And also, you grow breast tissue sometimes, but these are side effects. But if I had prostate cancer, obviously I would take it because it helps you to live and to block the growth of any tumor. But yes, it is an off-label use for transitioning people, and that is an issue. But
Mm-hmm.
No,
I want to move from that. I just wanted to clear that up. I wanted to move to that and just ask you your thoughts, Doctor, on what we're seeing. We're already seeing the beginnings of some of the food industry changing the ingredients, thanks to pressure that's coming in from the new administration. And what is your outlook right now on where we are going? You have talked extensively about this, about the food that we eat and how it can either help or hurt you or poison you. What are you thinking about where we are right now? The administration's still new, but where things are headed?
No, they're headed in a positive direction. We know that what we put into the mouth affects our oral microbiome and our gut microbiome, and our gut is 80% of our immunity. And what we feed our gut is critical. And when we're feeding
wait. Our gut is 80% of our immunity. Explain that.
It's our second brain. For example, when we digest food, it makes certain chemicals like the happy hormone for depression, the serotonin. A lot of it is made inside our gut. The gut and brain are connected through a nerve called the vagus nerve, and that is called the gut-brain axis. And we have now found that certain bacteria, if you're depressed, are higher or lower in the gut. When people have certain cancers, the guts are higher. There's a condition called small intestinal bowel overgrowth, small intestinal bacterial overgrowth in the bowel. It's called SIBO. And certain foods, certain artificial sweeteners, high fructose corn syrup causes the bad bacteria to overgrow. And a lot of the chemicals that we need for life happen in our gut. 75% of our white blood cells which fight infection, they hover around the lumen of the gut. The inside of your gut is actually the outside of your body. So that communication between how our food gets into our body and energy, that's what all this is going to be about. It's about these processed foods. So why do you have preservatives in food? Because you want them to sit in the supermarket shelf for a long time. So you put antibacterial preservative. But guess what? You inject the antibacterial preservative and it's killing some of the good bacteria and you're damaging it. And that's why farm-to-table eating is the best. That's why if you can have, clean wild-caught salmon, for example, you can, buy it online. It's really not that expensive versus one that's being fed corn. When your fish and a farm fish is being fed corn instead of the natural seaweed and other substances it alters the food. So we don't want our foods to be altered anymore. We want to stop genetically modifying the seeds as much. Yes, it's good to make resistant seeds, but we need to know what it does. We need to know all the antibiotics you feed chickens because they're all in these tiny, cramped up areas. When you eat that chicken, you eat that antibiotic. Again, it affects the gut microbiome because it kills some of the good bacteria. And when we start altering things in nature, we get into trouble. That's why I was excited about the executive order to stop the gain of function research. What that is they make viruses and they alter them to become more contagious so you can do more experiments in a faster way to test different drugs and medicine. The problem is if one of those escapes out of a lab, as we found out. So things like that are an example of man's technology is ahead of his biology. So we need to be careful how we alter our food and how it communicates with our gut microbiome. The soil communicates with our gut microbiome. When we eat, for example, extra virgin olive oil from a place like Morocco, which happens to be excellent, the soil, if it's dry and arid outside, a lot of UV, those plants make more polyphenols, they're called, and they've been shown to activate the longevity genes in our body called sirtuins. And the same thing is in actually avocado. That's why in the blue zones where people live longer, like Sardinia, Icaria, Greece, they found that the soil communicates with our gut microbiome, and those good foods that they eat, like olive oil, have this compound called oleic acid, and that stimulates the longevity genes, the sirtuin genes, and that's common in those areas. And then they said, oh, well, what about Loma Linda, California? They don't eat a lot of olive oil, but they eat a lot of avocados, which also has this oleic acid. So how the food we eat, the soil we eat, communicates with the gut microbiome, which is our second brain and 80% of our immunity, is really what we're targeting with all these changes, food dyes, food colorings, and how those things go into the gut and how they affect the thin lining of our gut, because that's the point of communication between our food and our energy and how we live. And also, we now know that certain dyes, for example, cause and stimulate cancer. So getting those out of the food supply chain is going to be amazing. And having things that don't have contaminants, just like the drugs being made in certain parts of the world, I think it's amazing. And I think we've been talking about this on WABC forever, how our supply chain is national security and it's our health security, that we need to know what's in our components. And that's another executive order, that the medicines have to be made here in the United States.
So much. You are such a wealth of information. Thank you. Thank you so much, Dr. Michalos. You are amazing.
No, thank you very much. I've been fortunate to be an associate professor at Columbia University for many years. I've been teaching medical students, and I love to teach, and I love to share with you on the show and keep our audience healthy and safe.
Amen to that.
The James Golden Show on the Red Apple Podcast Network.